I grew up 2 blocks from here and still live in the area. I only live 4 blocks from where I grew up. I think about 66% of this county leaves and goes to another county for jobs.
Perhaps Harnett County in North Carolina is easy to leave, a rural swath a drive away from cities like Raleigh and Charlotte. But those who stay, like Coley Price,
My whole career has been here in Harnett.
and David Tillman,
This is the county I love.
entrench their roots.
We're having the same issue that the nation's having, including metro issues.
So many people are dealing with it, and you know they're I hate to use the word embarrassed, but sometimes it is.
Price is Harnett County's deputy manager, Tillman the chair of public health at a nearby university. The issue they're dealing with is opioids. Drug overdose deaths nationwide have more than doubled in the last decade. In 2021, Harnett County lost 71 residents, an all-time high. To feel what that means,
I've been with the county since 2012.
talk to Jennifer Haney and Leslie Owens.
I have lived on the same piece of property that has been in my family for hundreds of years.
They're paramedics earmarked for opioid calls.
I think the average is probably 2 to 3 at least a day currently for an average. You know, when we're worried about making sure that Narcan is in every Harnett County school, it's a crisis.
But for counties in crisis, an opportunity has opened. Recent lawsuits with U.S. companies, drug wholesalers, and others have brought more than $50 billion nationally in settlements. In Harnett County, that means $11 million over 2 decades.
This is probably our most important and most expensive piece of equipment.
Their plan starts with Owens and Haney.
We have pediatric and adult.
They only handle opioid calls, spread across the county's 600 square miles.
We don't have the constraints of, you know, having to get to the next call. So we can sit down with these people, talk with these people.
The county plans to set up programs in prison to help users kick their addiction. And Price and Tillman are part of the inaugural class for Reaching Rural, an initiative helping rural communities nationwide team up on this topic.
In the urban setting, you have drug treatment courts, you have detox centers, you have transportation, you have housing. That's what we struggle with. If somebody wanted to go and try to help themselves in recovery, we got to drive an hour and a half to get to a drug treatment center.
It's too early to say what's working. Last year, opioid deaths in Harnett County dropped from 71 to 55. That's still the second largest number in county history. It's easy to give up. It's easy to throw one's hands up at a problem that seems too big to corral, unless your roots won't let you.
My uncles and cousins were on the fire department, helped put the recreation league together.
In this town, they're not sure if they have the answers, but they've got a plan. They've got funds, and they're trying.
Kind of have the history and heritage and wanted to keep that flame burning.
In Harnett County, North Carolina, I'm Matt Pearl.